Welcome to the lecture on Chapter 39, Terrorism Response and Disaster Management. After you as an EMT student complete this chapter and related coursework, you will be able to describe what constitutes terrorism and your response to terrorism, as well as being able to apply the knowledge you've learned. Additionally, you will demonstrate an understanding of weapons of mass destruction, agents, and countermeasures, as well as a fundamental knowledge of disaster management safety. Specific to the EMS education standards, you will have knowledge of operational roles and responsibilities to ensure patient, public, and personnel safety. Specific to mass casualty incidents due to terrorism and disaster, you will understand the risks and responsibilities of operating on the scene of a natural or man-made disaster. It is possible that you may be called on to respond to a terrorist event at some time during your career. The question is not, will terrorists strike again, but rather when and where they will strike. You must be mentally and physically prepared for the possibility of a terrorist event. It is difficult to plan and anticipate a response to many terrorist events, yet there are several key principles that apply to every response. Terrorist forces have been at work since early civilizations. International terrorism has brought a new fear into the lives of many American citizens. Modern-day terrorism is common in the Middle East, where terrorist groups have frequently attacked civilian populations. In the United States, domestic terrorists have struck multiple times in previous years. Only a small percentage of groups actually turn toward terrorism as a means to achieve their goals. Some of these are violent religious groups or doomsday cults. These include groups such as Aum Shinrikyo, and some of these groups may participate in apocalyptic-type violence. You also have extremist political groups. These include violent separatist groups and those who seek political, religious, economic, and social freedom. There are technology terrorists. These are the folks who attack a population's technological infrastructure as a means to draw attention to their cause, as well as cyber terrorists. And there are single-issue groups that include anti-abortion groups, animal rights groups, anarchists, racists, and even eco-terrorists. Weapons of mass destruction, or weapons of mass casualty, is any agent that is designed to bring about mass death, casualties, and massive damage to property and infrastructure, such as bridges, tunnels, airports, and seaports. There are two mnemonics for the kinds of WMDs that we see. One is Be Nice, and the other is CBRNE. Be Nice stands for Biologic, Nuclear, Incendiary, Chemical, and Explosive. CBRNE, Chemical, Biologic, Radiologic, Nuclear, and Explosive. Just, you can choose which one you would prefer to remember. To date, the preferred WMD for terrorists have been explosives. WMDs are relatively easy to obtain and create and are specifically geared toward killing large numbers of people. Chemical agents are manufactured substances that can have devastating effects on living organisms. They can be produced in liquid, powder, or vapor form depending on the desired route of exposure and dissemination technique. These agents consist of the following types: vesicants or blister agents, respiratory agents or choking agents, nerve agents, and metabolic agents like cyanides. Biologic agents are organisms that cause disease. They are generally found in nature for terrorist use. However, they are cultivated, synthesized, and mutated in a laboratory. The weaponization of biologic agents is performed to artificially maximize the target population's exposure to the germ, and the primary types are viruses, bacteria, and toxins. There have been only two publicly known incidents involving the use of a nuclear device. That is after World War... I'm sorry, I can't remember, but it was the Japanese bombing of Hiroshima and Nagasaki with the A-bomb. It is possible for a terrorist to secure radioactive materials or waste to perpetrate an act of terror. These materials are far easier for a determined terrorist to acquire and require less expertise to use. Dirty bombs can cause widespread panic and civil disturbances. Our response to terrorism, the thing we have to remember is that when you respond to a terrorist event, the basic foundations of patient care remain the same. However, your treatment can and will vary. When you are presented with widespread mass casualties, you must remember situational awareness. There are some indicators for recognizing a terrorist event. Most acts of terror are covert, which means that the public safety community generally has no knowledge prior knowledge of the time, location, or nature of the attack. You must consistently be aware of your surroundings and understand the possible risks for terrorism. You must know the current threat level issued by the federal government through the Department of Homeland Security. The Homeland Security Advisory System alerts responders to the potential for an attack, although the specifics of the current threat will not be given. Know the level at the start of your workday. Severe is also red, and that is a severe risk of terrorist attacks. High is orange, which is a high risk of terrorist attacks. Elevated is yellow, which is a significant risk of terrorist attacks, and guarded is blue, general risk of terrorist attacks, and low is green, low risk of terrorist attacks. Once you're on duty, you must be able to make appropriate decisions regarding the potential for a terrorist event. On every call, make the following observations. The type of location. Is it a monument, infrastructure, government building, or religious building? Is there a large gathering present? What type of call are you on? Is there a report of an explosion or suspicious device? Does someone have unexplained coughing and difficulty breathing? Are there reports of people fleeing the scene? How many patients do you have? Do you have multiple victims with similar signs and symptoms? This is probably the single most important clue that a terrorist attack or an incident involving a WMD has occurred. Listen to your victim statements. This is your second best indication of a terrorist or WMD event. Look for pre-incident indicators. Is the terror level high or severe? Has there been recent increase in violent political activism? Are you aware of any credible threats made against the location, gathering, or occasion? Response actions. Scene safety. Ensure that the scene is safe, remembering to stage your vehicle a safe distance from the incident. Wait for law enforcement personnel to advise you that the scene has been made secure. If you have any doubt that it may not be safe, do not enter. The best location for staging is upwind and uphill from the incident, just like a hazmat incident. Remember the following rules. Failure to park your vehicle at a safe location can place you and your partner in danger. If your vehicle is blocked in by other emergency vehicles or damaged by a secondary device, you will be unable to provide victims with transportation or escape yourself. Responder safety. The best form of protection from a WMD agent is preventing yourself from coming into contact with the agent. The greatest threat that faces you in a WMD attack is contamination and cross-contamination. Contamination with an agent occurs when you have direct contact with the WMD or are exposed to it. Cross-contamination occurs when you come into contact with a contaminated person who has not yet been decontaminated. Notify the dispatcher, providing that communications function properly. Inform them of the nature of the event, any additional resources that may be required, the estimated number of patients, the upwind, route of approach, or optimal route of approach. It is extremely important to establish a staging area where other units will converge. Be mindful of access and exit routes when you direct units to respond to a location. Trained responders and the proper protective equipment are the only persons equipped to handle the WMD. Keep in mind that there may be more than one type of device or agent present. Establish command. As the first person on scene, the EMT may need to establish command until additional personnel arrive. You and other EMTs may function as medical branch directors, triage supervisors, treatment supervisors, transportation supervisors, logistics officers, as well as command and general staff. If the initial incident command system is already in place, immediately seek out the medical staging officer to receive your assignment. A secondary device or event, reassessing scene safety. Terrorists have been known to plant additional explosives that are set to explode after the initial bomb. This type of secondary device is intended primarily to injure responders and to secure media coverage. Secondary devices may include various types of electronic equipment such as cell phones or pagers. It is every EMT's responsibility to constantly assess and reassess the scene for safety. Chemical agents are liquids or gases that are dispersed to kill or injure. The characteristics of an agent can be described as liquid, gas, or solid. Persistent or non-volatile agents can remain on the surface for long periods, usually longer than 24 hours. Non-persistent or volatile agents evaporate rapidly when left on a surface in the optimal temperature range. Route of exposure is a term used to describe how the agent most effectively enters the body. Agents with a vapor hazard enter the body through the respiratory tract in the form of vapors. Agents with a contact hazard or skin hazards give off very little vapor or no vapors and enter the body through the skin. The primary route of exposure of blister agents or vesicants is the skin. However, if they're left on the skin or clothing long enough, they produce vapors that can enter the respiratory tract. Vesicants cause burn-like blisters to form on the victim's skin and in the respiratory tract. The vesicant agents consist of sulfur mustard, leucite, and phosgene oxime. Vesicants usually cause the most damage to damp or moist areas of the body, such as the armpits, groin, and the respiratory tract. Signs of vesicant exposure on the skin include skin irritation, burning or reddening, immediate intense skin pain, formation of large blisters, gray discoloration of the skin, swollen and closed or irritated eyes, permanent eye injury including blindness. If vapors were inhaled, the patient may experience these signs and symptoms: hoarseness and stridor, severe cough, hemoptysis or coughing up blood, and severe dyspnea. Sulfur mustard is a brownish, yellowish, oily substance that is generally considered very persistent. As the agent is absorbed into the skin, it begins an irreversible process of damage to the cells. Mustard is considered a mutagen, which means that it mutates, damages, and changes the structures of the cells. The patient will develop a progressive reddening of the affected area, which will gradually develop into large blisters. Mustard also attacks vulnerable cells within the bone marrow and depletes the body's ability to reproduce white blood cells. Lewisite and phosgene produce blister wounds very similar to those caused by mustard. These agents produce immediate intense pain and discomfort when contact is made. The patient may have a grayish discoloration at the contaminated site. Treatment of vesicant agents. There are no antidotes for mustard or CX exposure. British anti-Lewisite is the antidote for Agent L, however, it is not carried by civilian EMS. You need to ensure that the patient has been decontaminated before you initiate ABCs, and transport should be initiated as soon as possible. Generally, burn centers are best equipped to handle the wounds and subsequent infections produced by the vesicants. Pulmonary or choking agents. The pulmonary agents are gases that cause immediate harm to persons exposed to them. The primary route of exposure is through the respiratory tract, which makes them an inhalation or vapor hazard. Once inside the lungs, they damage the lung tissue and fluid leaks into the lungs. These agents produce respiratory-related symptoms such as dyspnea, tachypnea, and pulmonary edema. Chlorine was the first chemical agent ever used in warfare. Initially, it produces upper airway irritation and a choking sensation. The patient may later experience these signs and symptoms: shortness of breath, chest tightness, hoarseness and stridor, as well as gasping and coughing. Phosgene has been produced for chemical warfare and is a product of combustion such as might be produced in a fire at a textile factory. Phosgene is a very potent agent that has a delayed onset of symptoms, usually hours. The odor produced by the chemical is similar to that of freshly mown grass or hay. The result is that much more of the gas is allowed to enter the body unnoticed. Initially, a mild exposure may include these signs and symptoms: nausea, chest tightness, severe cough, and dyspnea on exertion. A severe exposure produces such large amounts of fluid in the lungs that the patient may actually become hypovolemic and subsequently hypotensive. Treatment for pulmonary agents. The best initial treatment is to remove the patient from the contaminated atmosphere. This should be done by trained personnel in the proper PPE. Aggressive management of the ABCs should be initiated, paying particular attention to oxygenation, ventilation, and suctioning. Do not allow the patient to be active, and know that there are no antidotes to counteract a pulmonary agent. Nerve agents. The nerve agents are among the most deadly chemicals developed. They can cause cardiac arrest within seconds to minutes of exposure. Nerve agents are a class of chemical called organophosphates, which are found in household bug sprays, agricultural pesticides, and some industrial chemicals. Organophosphates block an essential enzyme in the nervous system, causing the body's organs to become overstimulated and burn out. G agents come from early nerve agents, the G series. Sarin, GB, is a highly volatile, colorless, and odorless liquid, especially dangerous in enclosed environments, and when it comes into contact with the skin, it is quickly absorbed and evaporates. When it is on clothing, it has the effect of off-gassing. Soman, or GD, is twice as persistent as sarin and 5 times as lethal. This agent is a contact and an inhalation hazard. A unique additive in GD causes it to bind to the cells that it attacks faster than any other agent. Tebune, or GA, is approximately half as lethal as sarin and 36 times more persistent. It is a contact and an inhalation hazard. V agent, or VX, is a clear, oily agent that has no odor and looks like baby oil. It is more than 100 times more lethal than sarin and is extremely persistent. It is easily absorbed into the skin, and the oily residue that remains is extremely difficult to decontaminate. Table 39.2 gives you a chart of the nerve agents, and use this as a study guide. Realize that the GA, GB, GD, and VX are military designations. They do have odors about them, and there are some special features that you need to know about. Use this as a study guide. Nerve agents all produce similar symptoms but have varying routes of entry. The symptoms are described using the military mnemonic SLUDGEM. Salivation or sweating, lacrimation or excessive tearing, urination, defecation, drooling, and diarrhea, gastric upset and cramps, emesis and vomiting, muscle twitching and meiosis, which means pinpoint pupils. This is the military mnemonic. The medical mnemonic that we use is dumbbells. Diarrhea, urination, meiosis, bradycardia and bronchospasm, emesis, lacrimation, seizures, salivation, and sweating. You may use either. They all pretty much have the same symptoms. Meiosis is the most common symptom of nerve agent exposure and can remain for days to weeks. Treatment for nerve agents. The most common treatment is the Mark I nerve agent antidote kit. It contains atropine and 2-PAM. Fatalities from severe nerve agent exposure occur as a result of respiratory complications, which lead to respiratory arrest. You can greatly increase the patient's chances of survival simply by providing airway and ventilatory support. Often in patients exposed to these agents, seizures will begin and will not stop. These patients will require administration of a nerve agent antidote. An updated version of the Mark I kit is the Duodote autoinjector. These medications are delivered using the same technique as the EpiPen autoinjector, and multi-doses may need to be administered because of the half-life. Metabolic agents or cyanides. Hydrogen cyanide, AC, and cyanogen chloride, CK, are both agents that affect the body's ability to use oxygen. Cyanide is a colorless gas with an odor like almonds. Besides the nerve agents, metabolic agents are the only chemical weapons known to kill within seconds to minutes. These deadly gases are commonly found in many industrial settings. In low doses, these chemicals are associated with dizziness, lightheadedness, headache, and vomiting. High doses will produce symptoms that include the following: shortness of breath and gasping respirations, tachypnea, flushed skin, and tachycardia. Also, altered mental status, seizures, coma, apnea, and cardiac arrest. Cyanide binds with the body cells and it prevents oxygen from being used. Once trained personnel wearing the proper PPE have removed the patient from the source of the exposure, all of the patient's clothes must be removed to prevent off-gassing in the ambulance. You need to support the patient's ABCs. Mild effects will generally resolve by removing the victim from the source of contamination and administering supplemental oxygen. Severe exposure will require aggressive oxygenation and perhaps ventilation with supplemental oxygen. Always use a BVM device or oxygen-powered ventilator, and if no antidote is available, initiate transport immediately. There is a cyano kit. They are very expensive. They run in the market of $1,200 to $1,500 each. I do know that Kalispell Fire has one that is available if needed. Biologic agents. Biologic agents pose many difficult issues when used as a WMD. They can be almost completely undetectable, and most of the diseases caused by these agents will be similar to other minor illnesses. Biologic agents are grouped as viruses, bacteria, and neurotoxins and may be spread in various ways. Dissemination is the means by which a terrorist will spread the agent. A disease vector is an animal that spreads disease once infected to another animal. How easily the disease is able to spread from one human to another human is called communicability. In instances where communicability is high, such as with smallpox, the person is considered contagious. Incubation describes the period of time between the person becoming exposed to the agent and the symptoms beginning. Viruses are germs that require a living host to multiply and survive. Once in the body, the virus invades healthy cells and replicates itself to spread through the host. Viruses move from host to host by direct contact, such as respiratory droplets or through vectors. The first virus we're going to talk about is smallpox. Smallpox is highly contagious. All forms of standard precautions must be used to prevent cross-contamination to healthcare workers. You need to wear gloves, a HEPA-filtered respirator, and eye protection. Before the patient shows rash or blisters, the illness will start with a high fever and body aches and headaches. An easy, quick way to differentiate smallpox from other skin disorders is to observe the size, shape, and location of the lesions. In smallpox, all of the lesions are identical in their development. The blisters begin on the face and extremities and eventually move toward the chest and abdomen. The disease is in its most contagious phase when the blisters begin to form. Viral hemorrhagic fevers, or VHFs. Table 39.4 gives you characteristics of smallpox and is a great study guide. VHFs consist of a group of diseases caused by viruses that include the Ebola, Rift Valley, and yellow fever viruses, among others. As you know, Ebola is rampant in Africa, and patients, U.S. citizens who have been exposed and have Ebola have been brought home. This group of viruses causes the blood in the body to seep out from the tissues and blood vessels. Initially, the patient will have flu-like symptoms, progressing to more serious symptoms such as internal and external hemorrhaging. All standard precautions must be taken when you treat patients with these illnesses. Table 39.5, a great study guide for the characteristics of VHFs. Bacteria. Unlike viruses, bacteria do not require a host to multiply and live. Bacteria are much more complex and larger and can grow up to 100 times larger than the largest virus. Most bacterial infections can be fought with antibiotics, and they generally begin with flu-like symptoms. Inhalation and cutaneous anthrax. Anthrax is caused by a deadly bacterium that lays dormant in a spore. When exposed to the optimal temperature and moisture, the germ will be released from the spore. The routes of entry are inhalation, cutaneous, and gastrointestinal. The inhalation form, or pulmonary anthrax, is the most deadly and often prevents a severe cold. Pulmonary anthrax is associated with a 90% death rate if it's left untreated. Antibiotics can be used to treat it successfully. The plague, or bubonic or pneumonic plague, its natural vectors are infected rodents and fleas. Bubonic plague infects the lymph system. When this occurs, the patient's lymph nodes become infected and grow. The glands of the nodes will grow large and round, forming buboes. If left untreated, the infection may spread through the body, leading to sepsis and possibly death. Pneumonic plague is a lung infection, also known as plague pneumonia, that results from inhalation of plague bacteria. This form of the disease is contagious and has a much higher death rate than the bubonic form. 39.7 gives you characteristics of the plague. Neurotoxins are the most deadly substances known to humans. These toxins are produced from plants, marine animals, molds, and bacteria. The route of entry is through ingestion, inhalation from aerosols, or injection. Unlike viruses and bacteria, they are not contagious and have a faster onset of symptoms. The first one we'll talk about is botulinum toxin. It is the most potent neurotoxin, which is produced by bacteria. When it's introduced into the body, the neurotoxin affects the nervous system's ability to function. Voluntary muscle control diminishes as the toxin spreads, and eventually it causes muscle paralysis, leading to respiratory arrest. Ricin. Table 39.8 is characteristics of botulinum toxin. Ricin is derived from mash that is left from the castor bean. When introduced into the body, ricin causes pulmonary edema and respiratory circulatory failure, leading to death. The toxin is quite stable and extremely toxic by many routes of exposure, including inhalation. The signs and symptoms of ricin ingestion include fever, chills, headache, muscle aches, nausea, vomiting, diarrhea, severe abdominal cramping, dehydration, and gastrointestinal bleeding, as well as necrosis of the liver, spleen, kidneys, and the GI tract. Now that was ingestion. The signs and symptoms of inhalation of ricin are as follows: fever, chills, nausea, local irritation of the eyes, nose, and throat, profuse sweating, headache, muscle aches, non-productive cough, chest pain, dyspnea, pulmonary edema, severe lung inflammation, cyanosis, seizures, and respiratory failure. The treatment is supportive and includes both respiratory as well as cardiovascular support as needed. There are other EMT roles that may occur during a biologic event. The first one is syndromic surveillance. Syndromic surveillance is the monitoring of patients presenting to emergency departments and alternative care facilities, as well as the recording of EMS call volumes and monitoring of the use of over-the-counter meds. Patients with signs and symptoms that resemble influenza are particularly important. Quality assurance and dispatch operations need to be aware of an unusual number of calls from patients with an unexplainable flu coming from a particular region or community. Points of distribution, or the strategic national stockpile. PODs are existing facilities that are established in a time of need for the mass distribution of antibiotics, antidotes, vaccinations, and other medications and supplies. These medications may be delivered in large containers known as push packs by the Centers for Disease Control and Prevention National Pharmaceutical Stockpile. They have a delivery time of 12 hours anywhere in the country. EMTs, advanced EMTs, and paramedics may be called on to assist in the delivery of medications to the public. Your role may include triage, treatment, and transport. This is an example of a pod. Radiologic and nuclear devices. What is radiation anyway? Ionizing radiation is emitted in the form of rays or particles. This energy can be found in radioactive materials such as rocks and metals. Radioactive material is any material that emits radiation. This material is unstable and it attempts to stabilize itself by changing its structure in the natural process called decay. The energy that is emitted from a strong radiologic source is alpha, beta, gamma, or neutron radiation. Alpha is the least harmful penetrating type and cannot move through most objects, as you see in the upper left picture. Beta radiation is slightly more penetrating than alpha and requires a layer of clothing to stop it, as you see in the picture on the upper right. Gamma rays are far faster and stronger than alpha and beta rays. These rays easily penetrate through the human body and require lead or several inches of concrete to prevent penetration. And finally, and this is in the lower left picture, and in the lower right picture, neutron particles are among the most powerful forms of radiation, and they easily penetrate through lead and require several feet of concrete to stop them. Radiologic material sources. Radiologic materials are generally used for purposes that benefit humankind, such as medicine, killing germs in food, and construction work. Once radiologic material has been used for its purpose, the material remaining is called radiologic waste, and these materials can be found in hospitals, colleges, and universities, and chemical and industrial sites. RDDs, or radiologic dispersal devices, are any container that is designed to disperse radioactive material. A dirty bomb carries the potential to injure victims with not only the radioactive material, but also the explosive material used to deliver it. The destructive capability of a dirty bomb is limited to the explosives that are attached to it. The dirty bomb is an ineffective weapon of mass destruction. Nuclear energy is artificially made by altering or splitting radioactive atoms. The result is an immense amount of energy that usually takes the form of heat. Nuclear material is used in medicine, weapons, naval vessels, and power plants. It gives off all forms of radiation, including neutrons. Nuclear weapons are kept only in secure facilities throughout the world. The likelihood of a nuclear attack is extremely remote. Due to the collapse of the former Soviet Union, the whereabouts of many small nuclear devices is now unknown. These small suitcase-sized nuclear weapons are called Special Atomic Demolition Munitions, or SADMs, and about 80 are missing as of 1998. The effects of radiation exposure will vary depending on the amount of radiation that a person receives and the route of entry. Radiation can be introduced into the body by all routes of entry as well as through the body, or irradiation. Some common signs of acute radiation sickness are listed in Table 3911, as you see here on your slide. Again, a great study source. Being exposed to a radiation source does not make a patient contaminated or radioactive. However, when patients have a radioactive source on their body, they are contaminated and must be initially cared for by a hazmat responder. Once the patient is decontaminated, you may begin treatment with the ABCs and treat a patient for any burns or trauma. There are no suits or protective gear designed to completely shield you from radiation. The best ways to protect yourself from the effects of radiation are time, distance, and shielding. Time. The less time that you're exposed to the source, the less the effects will be. If you realize that the patient is near a radiation source, leave the area immediately. Distance. Radiation is limited to in how far it can travel. Depending on the type, often moving only a few feet is enough to remove you from immediate danger. Make certain that responders are stationed far enough from the incident. And shielding. Always assume that you are dealing with the strongest form of radiation and use concrete shielding between yourself and the incident. IEDs, or incendiary and explosive devices. IEDs come in various shapes and sizes. It is important for you to be able to identify an object you believe is a potential device and notify the proper authorities, as well as safely evacuate the area. Remember that there is the possibility of a secondary device when you are responding to the scene. Mechanisms of injury. The type and severity of wounds primarily depend on the patient's distance from the epicenter of the explosion. Blast injuries occur in a number of ways. The primary blast injury is due solely to the direct effects of the pressure wave on the body. The injury is seen almost exclusively in hollow organs, and an injury in the lungs causes the greatest morbidity and mortality due to a decrease in oxygenation and ventilation. Secondary blast injuries. Penetrating or non-penetrating injuries that result from being struck from flying debris occur here. Objects are propelled by the force of the blast and strike the victim, causing injuries. And then tertiary blast injuries. These result from the whole body displacement and subsequent traumatic impact with environmental objects. Other indirect effects include crush injury from the collapse of structures and toxic effects from the inhalation of combustion gases. The physics of an explosion. When a substance is detonated, a solid or liquid is chemically converted into large volumes of gas under high pressure with resultant explosive energy release. This generates a pressure pulse in the shape of a spherical blast wave that expands in all directions from the point of explosion. Flying debris and high winds commonly cause conventional blunt and penetrating trauma. The tissues that are at risk include hollow organs such as the middle ear, the lung, and the GI tracts. These are most susceptible to the pressure changes. The junction between tissues of different densities and exposed tissues such as the head and neck are prone to injury as well. The ear is the organ system most sensitive to blast injuries. The patient may complain of ringing or pain in the ears or some loss of hearing, and blood may be visible in the ear canal. Primary pulmonary blast injuries occur as contusions and hemorrhages. Patients may complain of tightness or pain in the chest and may cough up blood and have tachypnea or other signs of respiratory distress. Subcutaneous emphysema over the chest can be palpated. Pneumothorax is common and may require emergency decompression. Solid organs are relatively protective from shockwave injury, but may be injured by secondary missiles or a hurling body. Hollow organs may be injured by similar mechanisms as lung tissue. Petechiae to large hematomas are the most visible signs. Neurologic injuries and head trauma are the most common causes of death from blast injuries. Subarachnoid and subdural hematomas are often seen. Permanent or transient neurologic deficits may be secondary to concussion, intracerebral bleeding, or air embolism. Instant but transient unconsciousness may be initiated. Bradycardia and hypotension are common after an intense pressure wave from an explosion. And extremity injuries, including traumatic amputations, are also common. In summary, as a result of the increase in terrorist activity, it is possible that you, the EMT, could witness a terrorist event. You must be mentally and physically prepared for the possibility of a terrorist event. Types and groups that tend to use terrorism include violent religious groups and doomsday cults, extremist political groups, technology terrorists, and single-issue groups. A WMD is any agent designed to bring about mass death, casualties, and/or massive damage to property and infrastructure. These can be biologic, nuclear, incendiary, chemical, and explosive weapons. Indicators that may give you clues as to whether the emergency is a result of a terrorist attack include the type of location, type of call, number of patients, victim statements, and pre-incident indicators. If you suspect that a terrorist or a WMD event has occurred, ensure that the scene is safe. If you have any doubt that it may not be safe, do not enter and wait for assistance. Terrorists may set secondary devices that are designed to explode after the initial bomb, thus injuring responders and media coverage. Constantly assess and reassess the scene for safety. Chemical agents are manufactured substances that can have devastating effects on living organisms. The route of exposure is how the agent most effectively enters the body. Biologic agents are organisms that cause disease, and they include viruses such as smallpox and those that cause viral hemorrhagic fevers. Bacteria such as those that cause anthrax and plague, and neurotoxins such as botulinum toxin and ricin. Nuclear or radiologic weapons can create a massive amount of destruction. Ionizing radiation is energy that can enter the human body and cause damage. Explosive and incendiary devices come in various shapes and sizes. It is important to be able to identify an object you believe is a potential device and notify the proper authorities while safely evacuating the area. As you listen to this lecture, think of any questions you might want to ask your instructor about WMDs, and please bring them to class with you. Thank you.